So we're here with Beccy Baird from the King's Fund, and we've been really lucky to work with our colleagues at the fund on this new report looking at mental health in primary care, and particularly the opportunity with primary care networks beginning to establish themselves around England now. Beccy, what can you tell us about primary care networks for people who don't know? What is a primary care network?
So primary care networks were established about 2 years ago, 18 months ago now, by NHS England as part of the long-term plan commitment. They're groups of GPs covering populations of roughly 30 to 50,000 people, so round and about 5-ish GP practices who come together to work together for their population. They have money attached to this as well. So, and particularly interesting for this project on mental health is that they've got some money to hire new roles into general practice. So, for example, in the first instance, they could hire pharmacists, physiotherapists, physicians associates, and community prescribing link workers and paramedics. And we're hoping as time goes on, the intention is that they'll be able to hire mental health workers too, which is really good to cover that population across those practices. So where they couldn't afford, for example, to hire a physiotherapist for one practice, they can if they share it across those practices.
That's great. And it's a really exciting opportunity, isn't it, that we could have mental health workers within primary care? Because I think we have seen some examples of where
Absolutely.
groups of GPs or local areas have really taken this seriously and thought that actually mental health is as important a part of the offer in primary care as some of the other things that we've seen in physical health.
And actually for some areas they'd see actually that's what we want more than anything else. We don't necessarily need pharmacy, we might already have pharmacy or whatever else. What we really want is mental health practitioners. I think there was maybe some nervousness from the centre about destabilising an already stretched workforce in mental health services, but I'm really pleased that we can now focus much more on mental health, because where we've seen it work well, for example, in thinking about Fleetwood in Lancashire and other places across the country that we talk about in our report that we've just launched, where you can see absolute benefits of these workers working closely. But the really critical bit is they're not isolated in general practice. What we don't want to see is them on their own.
Yeah, and this is really important, isn't it? Because for people who work in mental health services, they're part of a network. It's very multidisciplinary. You've got psychologists, social workers, peer support workers, nurses, psychiatrists, and lots of others working together. There is a worry that they might be quite isolated in GP surgeries, but again, there are some mental health trusts, for example, that have thought, well, actually we could really kind of reach out to primary care and do things differently and have that connection. And that's certainly what we've seen in Nottinghamshire, in City and Hackney, in some of the other, in Bradford, where there is more of an outreach, if you like, from mental health services into primary care. So you've got that relationship still, and it's not just one isolated worker.
Absolutely. And the whole point of this is about coming together and working together for the needs of the population, not transferring people from one bit of the system to another and working out who does that. It's about very much a shared understanding and a shared service delivery, which is what we'd really like to see, bringing primary care and mental health services closer together.
And this is where the Community Mental Health Framework, which is the plan that NHS England set up after the long-term plan for improving the links between primary and community services, could really help to reach out into primary care, because it is supposed to be a whole person, whole population approach, as the phrase that they've developed. And that's a really profound change, because I think we have seen, and it's really important to acknowledge, that there are significant groups of people who have really fallen between the gap between what primary care is traditionally able to offer, what you can get from your GP, what you can get from a talking therapy service, and what secondary care is able to offer. And many people are really kind of falling in the gap there. And this hopefully is an opportunity to really start to bridge that gap and to make sure no one falls through.
Absolutely, it's particularly those people with really complex needs, which on their own might not look like a severe need, but combined together mean that people really need help and support. And I think, bringing not just the mental health workers, but also the new community link workers, the social prescribers, all of those things that are coming into general practice to work together with secondary mental health care, where it's important to get that support, might mean that we can kind of provide people with what they really need, rather than putting them in boxes where they don't quite fit.
Yeah, in a sense, that phenomenon of being told your needs are too complex or not complex enough, we need to see an end to that. We need to think that if you have a proper stepped care system, nobody's told you're too complex or you need less than or more than we can offer. There's something for you no matter what your need looks like and what kind of complexity you've got. And I know, for example, we see people that have been in contact with the criminal justice system, young people who don't find the kind of mainstream offer particularly satisfactory. Very often it's the most vulnerable people. Migrants and refugees, again, are a group of people that often in inner city areas really struggle to get access to good mental health support when they need it.
Absolutely, and defaulting to GPs who don't feel able to cope with some of these really complex problems without the support of more specialists intervention is really important too. And I know that it's something that GPs have been concerned about for a long time and will hopefully welcome this opportunity to work closely together. It's not going to be easy. It's never easy to do integrated working, but I'm hoping that if we can kind of join up at all levels, from the front line right up to NHS England and improvement, where they need to come together to give a kind of shared approach to this group of people, that would be really helpful.
Yeah, and you spend a lot of time working with people in primary care networks. You've been very much involved in some of the thinking around that. What do you think would be their message to people working in the mental health system, in mental health services? What do you feel they need? What are they telling us that they would find really helpful?
I think coming together and listening to what the needs of our population are. So I think where I have worked, we've seen mental health services under enormous stress and enormous pressure, what feels like retrenching, pulling back from general practice and finding ways to say no, that we can't take this person. And actually what general practice is saying is, well, we could probably handle this particular issue 80% of the time, but we need your input to help us with the bits we can't. And how can we improve that communication? So instead of trying to shout across to each other, we come together and do some shared care. I think actually, for example, some of the digital technologies we've seen spring up over the last few months might often also a really interesting way of being able to provide, for example, shared outpatient consultations, shared conversations between GP, psychiatrists, specialist mental health team and patient, where people can come together and really discuss what will work best, rather than moving people between pillar and post.
Absolutely, and I think this is now a real opportunity to build those bridges. You know, we've seen in the course of the last few months in the crisis situation we've been in, that people have been able to come together in very different ways, including voluntary and community sector organisations that have been brought in. Many are obviously experiencing significant financial issues as a result of that, but there is a willingness to work together, a willingness to find shared solutions. Probably the one thing we've missed is the voice of people who've lived experience in that. It's been very much a kind of system knows best type response, but overall, at least there is an understanding that coming together is important, and let's build on that. Let's make this an opportunity to the overhackneyed phrase, build back better.
Yes, and around where people are and where people live, because I think that's been a real kind of strength of some of the response around this has been people in their very local communities coming together. And I think that's something incredibly important for general practice and for mental health services to bring all of those people together, including the people, and help design with the people with lived experience rather than doing two. But as we develop these new roles, work as a group to think about what will work best.
Thank you. Beccy, it's been a real pleasure to work with you on this report. I hope people will read it. I hope people will find it useful. I hope we've got some good insights in there that people can work with, and whatever your role in your local area, please do have a read of the report. Do take it and make use of it. And Beccy, thank you for working with us on this.
Thanks, Andy.